Hi, this is Dr. Karen Becker, and today we're going to discuss anemia in pets. Anemia is a condition in which there are an abnormally low number of red blood cells called erythrocytes, or hemoglobin, in the blood. Hemoglobin is a protein molecule inside red blood cells. Its job is to move oxygen in the blood to all of the tissues of the body. As red blood cells age, they have an average lifespan of about 2 months, or are damaged. They are collected by the spleen and removed from circulation. Part of the hemoglobin molecule is recycled to the bone marrow to be included in new red blood cells. Other parts are excreted by the liver. There are 3 causes of anemia: blood loss, destruction of red blood cells, also called hemolytic anemia, and insufficient production of red blood cells, also called aplastic anemia, which is the cause of about 80% of feline anemias. Anemia caused by blood loss can result from trauma, surgery, or another bleeding disorder that results in a sudden reduction of the overall numbers of circulating red blood cells. However, anemia from blood loss can also be the result of a slower chronic condition, including bleeding in the GI tract due to ulcers, internal or external parasites, cancer, as well as a bunch of other conditions. Hemolytic anemia is caused by the destruction or shortened lifespan of red blood cells, which means there is a low overall circulating red blood cell volume. This type of anemia can be either immune-mediated or non-immune-mediated. Autoimmune hemolytic anemia is a condition in which an animal's body sees its own red blood cells as foreign invaders and sets out to destroy them. Non-immune-mediated hemolytic anemia is caused from the destruction of red blood cells by other methods, including red blood cell parasites, hereditary diseases, toxins and poisons, or a low phosphorus level. Aplastic anemia, which is insufficient production of red blood cells, is caused by several different disorders, including tumors of the bone marrow, chronic kidney disease, and other disorders which affect the production of red blood cells. Other disorders that result in this type of anemia include infections such as parvovirus or Ehrlichia, drugs like chemotherapeutic agents, sulfa drugs, estrogens, and sometimes exposure to radiation and toxins. When a pet has an abnormally low volume of red blood cells and consequently insufficient hemoglobin to carry oxygen to the body's tissues, he experiences oxygen starvation. So some of these symptoms can include weakness, lethargy, exercise intolerance, an elevated heart rate, pale mucous membranes, which is usually the gum color. Sometimes the tongue can become pale pink to white, mental confusion, a loss of appetite, rapid breathing, as well as collapse. If the patient is passing a large amount of digested blood from their GI tract, then they can have a black tarry stool as well. Anemia isn't difficult to diagnose. The typical diagnostic tests include a complete blood count, a packed cell volume, and a serum biochemistry panel. A blood smear will be able to be analyzed underneath the microscope, and that will evaluate the structure of the red blood cells. A urinalysis may also be performed, as well as a test that could check for Ehrlichia canis if the patient is a dog. The vet might also do a coagulation panel, as well as a mucosal bleeding time test to evaluate your pet's clotting ability. A fecal test might also be performed to check for occult blood loss, which is blood loss from the intestines. A diagnosis of anemia doesn't identify the underlying problem, however. So there are several other tests that sometimes need to be run to determine the cause of the low red blood cell volume. Those tests can include an abdominocentesis to check for fluid or blood in the abdomen due to trauma, a bleeding disorder, a problem with the spleen, or a complication from a prior surgery. Other tests can include abdominal x-rays, an ultrasound, or endoscopy to look inside the abdomen to look for the presence of tumors or ulcers. There also may be tests to identify the presence of mycoplasma and babesia in the blood, sometimes DNA tests to look for genetic defects in susceptible breeds, and tests to determine if there's cancer present in your pet's body. If you think your pet may be anemic, you should make an appointment with your veterinarian as soon as possible. Anemia can be life-threatening depending on what's causing it. Treatment goals for patients with anemia are to control bleeding and restore blood volume, find and resolve underlying causes of chronic blood loss, as well as provide supportive care. Depending on the cause of the anemia, treatment options can include IV fluid therapy to increase blood volume, transfusions of packed cells or whole blood, platelets or fresh frozen plasma, transfusions of bone marrow, antibiotics if infection is present, vitamin K1 for coagulation disorders or certain poisonings, GI protectants, antiparasitic medication, potassium phosphate supplementation, or surgery to fix the source of the bleeding. Rarely is anemia related to iron deficiency in pets, as it is in many women, so iron supplementation should be avoided unless your pet is one of the very rare cases where actually iron deficiency is present. Anemic pets must be carefully monitored. Acute aplastic anemia can be reversed within a few weeks once the cause is identified. Chronic aplastic anemia is usually a more serious condition and more difficult to resolve. Blood loss anemia can be resolved as soon as the source of the bleeding is identified and repaired. Anemia caused by cancer has a less optimistic prognosis and depends on the pet's response to treatment for the cancer. Many causes of hemolytic anemia can be resolved once whatever is causing the destruction of the red blood cells has been identified.